Hello everyone, I'm Dr. Amit. Welcome back to our microbiology series. Okay, so whether you are preparing for USMLE, NEET PG, or your MBBS professional exams, today video is high yield. So in our last video, we covered the general classification of gram-positive bacteria. Okay, so today we are diving deep into Staphylococcus family, that Staphylococcus aureus, epidermidis, and saprophyticus. Okay, so let's have a quick recap from the last video. Okay, so we all know that gram-positive bacteria. Okay, so when we do gram staining, purple or blue, then it's three types: bacilli, cocci, and branching filaments. So if it's cocci, then we'll perform catalase, we'll see the bubble. If it's positive, then staphylococcus. If it's negative, then streptococcus. Okay, then we'll perform a coagulase. Okay, coagulase test. Okay, and we'll look for clotting. Okay, then if it's positive, staph aureus. If it's not, and then we'll do novobiocin sensitivity. If it is sensitive, then epidermidis. If not, then saprophyticus. Okay, so in this video today we'll discuss in detail about staph aureus, staphylococcus epidermidis, and staphylococcus saprophyticus. So let's start with the most famous member of this group is Staphylococcus aureus. Okay, so as we all know, the lab characteristics of Staphylococcus aureus is a gram positive, catalase positive, coagulase positive, and it's beta hemolytic. Okay, so sometime MCQ asked like what's the virulence factor of Staphylococcus aureus. Okay, so always remember protein A. Protein A is the virulence factor of Staphylococcus aureus. Okay, so what actually protein A do? So it inhibit the complement activations. Actually, whenever any infection or any bacteria enters our body, complement system get activated, but this protein A inhibit the complement system and also inhibit the phagocytosis. Okay, so when we'll talk about where it naturally occurs in our body. Okay, so Staph aureus naturally colonize in our nose, nares, ears, axilla, and groin. Okay, so let's talk about what are diseases caused by Staph aureus. Okay, so Staph aureus causes inflammatory disease. Okay, so inflammatory like skin infections, organ abscess, pneumonia, infective endocarditis, septic arthritis, and osteomyelitis. Okay, now it also causes toxin mediated disease. Okay, toxin mediated disease. Okay, so sometimes toxic shock syndrome, that TSST1. Okay, and sometimes exfoliative toxins causes scalded skin syndrome. Okay, then enterotoxin causes rapid onset of food poisoning. Okay, now we'll have a quick look on this group, that is MRSA, methicillin resistant Staph aureus. Okay, so MRSA is it's mainly causes healthcare associated and community acquired infections. Okay, then we'll also talk about TSST1, this toxic shock syndrome, TSST1. Okay, so it's actually a super antigen that bind to MHC2 and T cell receptor, and it causes polyclonal T cell activation and cytokine release. Okay, and at last causes toxic shock syndrome. Okay, so this is all a little bit overview of Staphylococcus aureus. Okay, now we'll talk in detail about Staphylococcus toxic shock syndrome. So while talking on staphylococcal toxic shock syndrome, okay, so when you talk about this, we'll look on this clinical features. Okay, so the first one is fever, then vomiting. Okay, if a patient has fever, vomiting, diarrhea. Okay, and rash. Okay, that's a characteristic rash. Then desquamation, shock, and in-organ failure. Okay, so while looking in the lab reports of staphylococcal toxic shock syndrome patient, we'll see you will see that there will be elevated AST, ALT, and bilirubin. Okay, so the LFT will be deranged. Okay, then while looking how actually it occur. Okay, what's the main association? Okay, so prolonged use of vaginal tampons or nasal packing. Okay, in this patient, this staphylococcal toxic shock syndrome is very common. Okay, so there is one pro tip. Okay, whenever you see a patient with toxic shock syndrome, so always think of two organisms. Okay, one is staphylococcal and another one is streptococcus pyogenes. but how to differentiate. Okay, so the main pro tip to differentiate is if that toxic shock syndrome caused by Streptococcus pyogenes, then it is associated with painful skin infections, but in case of Staphylococcal, there will be no painful skin infections. Okay, so now we also know that sometimes this enterotoxin also causes rapid onset of food poisoning. Okay, so we'll look into this. Okay, so food poisoning caused by Staphylococcus aureus. So it's mainly due to ingestions of preformed, okay, already formed toxins. Okay, that is enterotoxin. So it is a very short incubation period, only of 2 to 6 hours, and it causes non-bloody diarrhea and emesis. Okay, so that's all about Staphylococcus aureus. Now we'll talk about the next member, that is Staphylococcus epidermidis. Okay, so this bacteria is gram positive, catalase positive, urease positive, but it is coagulase negative. Okay, so it's a coagulase negative. So if the Staphylococcus is coagulase negative, then we'll perform novobiosine sensitive test. So this Staphylococcus epidermidis is novobiosine sensitive positive. Okay, so but it doesn't ferment mannitol. Okay, but Staph aureus ferment mannitol. So it's a difference between Staph aureus and epidermidis. Okay, where we'll find, okay, where we find this Staphylococcus epidermidis? So it's a normal microbiota of skin. So what's the clinical significance, okay, of knowing this bacteria? Okay, so it is a primary culprit. Okay, it's a primary culprit for infection related to prosthetic device, okay, like hip implants, heart valves, or IV catheters. Okay, and it's mainly affect, okay, by producing the biofilms. Okay, so whenever you see any patient having infection after hip implant or infection in the heart valve or IV catheters, so think about Staphylococcus epidermidis. Okay, so we'll see the next member of Staphylococcus, that is Staphylococcus saprophyticus. Okay, last but not the least, okay, this is Staphylococcus saprophyticus. So while talking about the lab profile of Staphylococcus saprophyticus, it is also gram positive, catalase positive, urease positive, leukocyte esterase positive. Okay, and the key thing is it's coagulase negative. Okay, so this differentiate it from Staphylococcus aureus. Now we'll do novobiosine resistant antibiotic test. This one is novobiosine resistant. Okay, so if it's resistant, then we can differentiate that it's a key point to differentiate from epidermidis and saprophyticus. Okay, saprophyticus is sensitive, but this one is resistant. Okay, and this is also nitrite negative. Okay, so while talking about the normal habitat of Staphylococcus saprophyticus, okay, so it's normally found in female genital tract and perineum. Okay, now the most important point is while talking about its clinical importance, okay, why we need to remember this. So sometime MCQ also asked in the USMLE and all the page examinations, what's the second most common cause of UTI in young female? Okay, so always remember Staphylococcus saprophyticus is the second, not first. Okay, second most common cause of UTI in young female. So which one is first? So always remember E. coli. E. coli is the most common organism which causes UTI in young female. Okay, so that's a wrap of Staphylococci. Okay, so mastering these differences is essential for your exams. Okay, so if you found this helpful, please like this video and share it with your colleagues. Okay, and subscribe my channel for more high-yield medical lectures. Okay, happy studying. Thank you.